Senator Marshall.
Thank you, Madam Chair. My first question for Dr. Walensky. As a physician, we always want to be able to know and discuss the benefits and risk of anything that we're prescribing, including a vaccine. It's estimated that 40, maybe 50% of children have already had the COVID virus. What are the additional benefits to the vaccine to a child who's already had the virus?
I think it very much depends on what the variant that child might have had, whether they could potentially be infected or reinfected. And, you know, one thing I just want to note with the children is I think we fall into this flawed thinking of saying that only 400 of these 600,000 deaths from COVID-19 have been in children. Children are not supposed to die. And so 400 is a huge amount for a respiratory season.
Thank you. Dr. Woodcock, how many children under the age of 18 without a pre-existing condition, a significant health condition, have died from COVID in this country?
I don't have that at my fingertips. I'm sorry.
Dr.
Over 400.
Without health
that
condition.
I don't
So
know.
I think the answer is probably zero. So I think if you take a deep dive, most of the children that have died had some type of underlying health condition. Dr. Fauci, in my hand is a three-dimensional printing of the COVID spike, something that's certainly a scientific, just baffles me in so many ways. It's composed of two units, as you know. There's an S2 subunit and an S1, and I'd like you to talk about the S2 subunit for a second. Can you explain the significance of the furin cleavage site, the double arginine CGG codon, if you would, and how that works clinically for us?
Yeah, thank you for that question, Senator. The furin cleavage site is a site of a set of amino acids, which is at the point where the enzyme furin can cleave it so that the virus can then bind to the receptor cell and then enter the cell. So it is seen on a number of viruses. It's been seen it's on the SARS-CoV-2, and it's also seen on other beta coronaviruses. You asked also about the double CGG codon.
Right.
That is a codon, again, that is unusual, but it is also seen on a number of beta coronaviruses. It is not a very common codon for the amino acid in question, but it is seen in coronaviruses.
Dr. David Baltimore, a Nobel laureate, I'll quote him here. "When I first saw the furin cleavage site in the viral sequence with its arginine codons, I said to my wife, it was the smoking gun for the origin of the virus. These features make a powerful challenge to the idea of a natural origin for SARS-2. And again, this is Nobel laureate Dr. David Baltimore saying this.
Right.
Would you agree or disagree with Dr. Baltimore?
Well, Dr. Baltimore, who is an extraordinarily accomplished scientist, has backtracked on that statement and says, I wish I had not used the word smoking gun when it was pointed out to him that actually this is seen in a number of coronaviruses, including one of the common cold coronaviruses. So I believe if you would ask...
So you disagree with him?
Well, I agree with his second statement where he backtracked and said he wished he had not used...
So you disagree with his first statement, though?
And he disagrees with his first statement.
Okay, he's not going to answer the question. We also have the S1 subunit, and I refer to the timeline behind me here, that there was a moratorium placed for viral gain of function in 2014. And I think you'll agree with me that the NIH funded research that led to this, an S1 spike that looks very similar, if not exactly, to what's on the COVID-19 spike.
What are you referring to, Senator? Can you please be more specific?
Yeah. So I'm talking about the S1 subunit of the current COVID-19 spike.
Yeah, what about it? I mean, are you talking about an experiment? Are you talking about a paper that was published?
So I'm talking about viral research that was done using NIH funding with the North Carolina lab, and Dr. Shi developed this S1 subunit spike that looks exactly like what we have on the current COVID-19 spike.
Yeah.
Is that not true?
No, I'm not sure exactly what you're referring to. Are you referring to the paper of Barrick and Shi in Nature Immunology? Is that what you're referring? I need to know specifically.
Yeah, so Dr. Barrick and Shi printed studies on this S1 unit that was basically the development of the key to the door that was specifically took the original SARS virus and made it so it would bond to the human lung cells.
No, there was no gain. If you're referring, Senator, to gain of function, by the definition.
Okay,
at
that's
the
not my
pause-
question.
Well,
But
well-
would you agree that
But
the,
when-
the spike that was developed there is what's also on the current
Yeah, but
COVID-19 virus?
that's irrelevant to anything until you have a context in which you're putting it. You're talking about an S1 and a spike in what context? If you're talking about a paper that was written by them?
But you agree or disagree that it's the same spike?
I'm not sure what you're talking about, Senator. I'm really not sure what you're talking about.
Okay, thank you.
All right.
Thank you. Senator Casey.
Thank you, Chair Murray, and I want to thank the panel.